Knowing proper first aid is crucial. It can make a real difference in an emergency. It can even save lives. This essay will debunk common first aid mistakes. It will provide clear and practical advice. This way you can be prepared and act effectively. It's tempting to remove something from your eye. The discomfort can be unbearable, but rubbing or touching your eye can lead to more serious issues. Your eyes are incredibly delicate and sensitive organs. Rubbing your eye can scratch the cornea or push the foreign object deeper, leading to infections and long-term damage. Never try to remove anything embedded in the eye. Seek immediate medical attention. Only attempt to remove an eyelash. Wash your hands thoroughly before touching your eye. Try to blink or make tears to flush it out. If this doesn't work, use a damp, clean cloth. If you experience pain or irritation, seek medical help. Persistent discomfort can be serious. Applying ointment to a wound seems helpful. However, ointments trap moisture. This creates an ideal breeding ground for bacteria. Instead, clean the wound with cool water and mild soap. Pat it dry. Then, cover the wound with a sterile bandage to prevent infection. Rubbing alcohol and vinegar are popular home remedies for fever, but they can be dangerous. Rubbing alcohol can be absorbed through the skin. This is particularly concerning for children as their skin is more permeable. Alcohol poisoning can cause dizziness and confusion. Vinegar can disrupt the body's pH balance, causing irritation and discomfort. Instead, use safer methods like a cool, damp cloth or a fan to reduce fever. Always consult a doctor if the fever is high, persistent, or accompanied by other worrying symptoms. Section 5. Fainting, letting nature take its course. It's natural to want to help someone who has fainted, but lifting them can be dangerous. Instead, loosen any tight clothing. Ensure they are lying flat on their back. This improves blood flow to the brain. Once conscious, let them sit up slowly. Offer water and monitor their condition. Section 6. Burn care, avoiding the butter trap. Butter or sour cream might seem soothing on a burn, but they actually trap heat. This can worsen the burn and increase pain. Hold the burn under cool running water for 15 minutes. This helps cool the area and reduce inflammation. Then cover the burn with a sterile, non-stick bandage. Seek medical attention for severe burns. Section 7. Blisters, tiny shields of protection. Blisters are the body's natural defense mechanism. They form a protective barrier over damaged skin. Popping a blister breaks this barrier. This increases the risk of infection. Leave blisters intact. They usually heal on their own. If large or painful, consult a healthcare professional for proper treatment. Section 8. Broken bones and dislocations. When to call for help. Never attempt to straighten a broken bone or dislocated joint. This can cause further damage. Immobilize the injured limb using a splint or sling. Seek immediate medical attention. Prompt medical care is essential for proper healing and preventing complications. Section 9. Sprains, the power of cold. Applying heat to a sprain might seem comforting, but it can increase inflammation and swelling. Instead, apply ice to the injured area for 20 minutes at a time. Use a thin cloth between the ice and skin to prevent ice burns. Repeat every 2 to 3 hours for the first 48 hours. This helps reduce pain and swelling. Section 10. Poisoning, don't induce vomiting. Inducing vomiting used to be a common response to poisoning, but it can be dangerous and cause further damage. Instead, call your local poison control center immediately. They can provide specific instructions based on the substance. Section 11. Drowning, safe rescue techniques. If you see someone drowning, your instinct might be to jump in and help. However, water rescues can be extremely dangerous for both the person in distress and the rescuer. The person drowning is likely to be in a state of panic and might unintentionally pull you under in their desperation. If possible, reach out to them with a pole or rope to maintain a safe distance. If you must enter the water, approach from behind to minimize the risk of being grabbed. Support their head above water and bring them to safety. Seek medical attention immediately. Your safety is paramount. Section 12. Embedded objects. Leave it to the professionals. Pulling out an embedded object might seem quick, but it can cause more damage and bleeding. Instead, control bleeding with pressure. Stabilize the object with bandages. Seek immediate medical attention for safe removal. Section 13. Ice and injuries. Using it safely. Applying ice directly to an injury can damage the skin. Always wrap the ice pack in a cloth before applying it to the skin. Limit ice application to 20 minutes, followed by a 90-minute break. This helps reduce swelling and pain without causing tissue damage. Remember, this information is for guidance only. Always seek professional medical advice for health concerns or emergencies. Stay informed and safe. If you like this video, please like, subscribe and share. Press the bell icon for more informative videos like this. Stay tuned and goodbye.